For next 5 to 6 minutes, I'm going to talk about imaging-based classification of neck nodes. Imaging-based classification should be compatible with currently widely accepted clinical classification so that communication with clinicians will be easy. For classification of neck nodes, we should remember few of bony and soft tissue landmarks. The bony landmarks include the skull base at the level of jugular fossa, the hyoid bone, the cricoid cartilage, the manubrium, the clavicles, and the soft tissue landmarks include anterbelly of digastric muscles, the submandibular salivary glands, the sternomastoid muscles, trapezius, anterscalene muscles, carotid sheaths, and IJV. In this figure, we can see anterbelly of digastric muscles, submandibular salivary glands, hyoid bone, cricoid cartilage, manubrium, clavicles, trapezius, sternomastoid muscle, and scalene muscles. The level 1 nodes. Level 1 nodes are the nodes which lie below the mylohyoid and above the hyoid bones, and these in turn are divided into 1A and 1B nodes. 1A nodes are the nodes which lie medial to anterior belly of digastric muscles, and 1B nodes lies posterolateral to anterior belly of digastric muscles and anterior to posterior margin of submandibular salivary glands. Here, this is image showing antebelly of digastric muscles, medial to which 1A nodes will lie, and anterior to submandibular salivary glands. Anterior to posterior margin of submandibular salivary glands, we can see 1B nodes, and this is the line drawn posterior to posterior margin of sternomastoid muscles, which delineates level 5 nodes from other nodes. Coming to level 2 nodes, these nodes are also situated above the level of hyoid but lie posterior to posterior margin of submandibular salivary gland. And these nodes are in turn divided into 2A and 2B nodes. And level 2 nodes which lie up to 2 centimeters from skull base, and the nodes which lie medial to carotid sheath are considered as retropharyngeal nodes. Beyond 2 centimeters, they are considered as uh, up beyond 2 centimeters, the nodes can lie medial to carotid sheath or IJV. Caudal to 2 centimeters, 2A nodes can lie anterior, medial, and lateral to IJV, and the nodes can also lie posterior to IJV but inseparable from the IJV. Level 2B nodes lie posterior to IJV with well-defined fat plane separating nodes and vein. These are the level 2 nodes which lie posterior to IJV with a well-defined flat plane. So these are level 2B nodes. And this is the node which lie anterior to IJV, and this level is above the level of hyoid. So we are dealing with level 2 nodes. And this is anterior to IJV, so 2A nodes. Coming to level 3 nodes, these are the nodes which lie between the lower border of hyoid and the level of lower margin of above the level of cricoid, and lie anterior to posterior margin of sternomastoid and lateral to medial margin of ICA or CCA. The nodes which lie medial to ICA or CCA are considered as level 6 nodes or visceral nodes. Then these are the level 3 nodes. These are the level 3 nodes. This is the level of up to at the level of thyroid cartilage. That means this is the level below the level of hyoid. So this is level 3 and above the level of cricoid. So these nodes are anterior to posterior margin of sternomastoid. And this is the node which lie posterior to posterior margin of sternomastoid, and this is 5A node because this is above the level of cricoid. Then level 4 nodes are the nodes which lie below the level of cricoid and above the level of clavicle and anterior to posterior margin of sternomastoid. These are the level 4 nodes. This is below the level of cricoid at the level of thyroid gland. This is definitely below the level of cricoid cartilage, and this is above the level of clavicle, and this is These are level 4 necrotic nodes. And these are level 5B nodes which lie posterior to sternomastoid and anterior to trapezius and below the level of cricoid cartilage. These are level 5B nodes. Coming to level 5, these are the nodes which lie posterior to posterior edge of sternomastoid from skull base up to the level of clavicle, and these lie anterior to anterior border of trapezius. 5A nodes are the nodes which lie from they lie between skull base up to the level of lower margin of cricoid arch behind posterior edge of sternomastoid muscle, and 5B nodes between lower margin of cricoid cartilage to the level of clavicle. Then coming to level 6 nodes. Level 6 nodes are the nodes which lie medial to bilateral ICA or CCA, inferior to the level of hyoid and superior to manubrium. These are level 6 nodes. Then coming to level 7 nodes are the nodes which lie below the level of manubrium up to the level of brachiocephalic veins. And these nodes are also situated medial to medial margins of right and left common carotid arteries. These are the level 7 nodes below the level of manubrium, and these are multiple axillary lymph nodes. Once any portion of clavicle is seen on the scan and nodes lie lateral to carotid arteries, these are considered as supraclavicular nodes. And if the nodes lie below the level of clavicle and lateral to the ribs, they are considered as axillary nodes. Then, to summarize, we have to divide nodes into midline nodes and off midline nodes. Midline nodes includes 1A, 6 and 7. Off midline nodes includes 2, 3, 4 and posterior to sternomastoid are level 5A and 5B. And bony and soft tissue landmarks to be remembered include hyoid bone, skull base, hyoid bone, cricoid cartilage, manubrium and clavicles. And soft tissue landmarks include antibelly of digastric, submandibular salivary glands, and sternomastoid and trapezius muscles. And these are my